Dear colleagues, this is an interesting case of iris repair. The case was operated in a different service, and previous surgeon did phacoemulsification, probably had a posterior capsule opening, posterior capsule rent, because the IOL it's not centrated well. So I'm assessing the situation, see where the leading haptic is, and I find that probably the leading haptic was inserted inside the bag. The posterior one, the trailing haptic, was in the sulcus. Having the opening into the posterior capsule led to the fact that the IOL went with the haptic through that opening, and I'm trying to rotate now, push some viscoelastic to push the vitreous back. If the previous surgeon didn't do anterior vitrectomy, and I don't know the surgeon, I don't know the situation inside the operating room, how the things went. I'm trying to place the IOL inside the sulcus and then rotate the haptics in the position that's no longer in that area where the posterior capsule is broken, and then fixing up that iris defect. Probably the surgeon went with the phaco probe into the iris stroma and made another pupil there, because the patient, being a truck driver, describing the having seen the two images, and this is very dangerous during the night because he has no appreciation of the incoming traffic. He don't know exactly where the car that's approaching him is, so that's very dangerous. So using the straight needle, I'm fashioning a Siepser knot, closing the iris defect with 3 to 1 Siepser knot, and closing that iris defect and making the patient smile again. Post-op, the patient did very well. The IOL remained centrated for up to a month that he came, and everything was okay. And the iris defect being repaired, the image got back to normal, so he's seeing just one car approaching, not two different ones. Doubling the image on this eye is no longer a case, so everybody is happy now. So closing up this Siepser knot, we have to pay attention to the iris stroma when we tighten the knot, in order to not pull too much on the iris. Pulling too much on the iris, we can end up with broken of that stroma, or even worse, you can have an iris dialysis. So we have to tighten the knot very careful, paying attention to the knot, and that's the most tricky part of the surgery. Thank you for your attention. Hope this will help you in your practice also.